Today our competency is blood pressure, factors affecting blood pressure and its regulation. After completion of today's lecture, we'll be knowing what is blood pressure, different types of blood pressures are there, and what are its significance, what are the functions of the blood pressure, and we'll be knowing the variations, physiological variations, what are the conditions in which blood pressure varies. Then we'll discuss what are the main factors that regulate blood pressure. Okay, and finally we learn about the regulation of blood pressure. So different processes, mechanisms are there for regulations, we will study that. Okay, now let us start with what our today topics are. I already told what would be the topics. Now what do you mean by blood pressure? Blood pressure, conventionally we know blood pressure is actually arterial blood pressure. So what is the arterial blood pressure? It is defined as the lateral pressure exerted by the column of flowing column of blood on the wall of the blood vessels. So this is blood pressure. Okay, and its unit is millimeter of mercury. Arterial blood pressure is expressed in 4 different ways. What are these? One is systolic pressure, another is diastolic pressure, mean pressure, pulse pressure, and these are the 4 things: pulse pressure, mean arterial blood pressure, diastolic and systolic blood pressure. Now we see what is systolic blood pressure. So see the diagram. When ventricle contracts, means systolic. When ventricle is in systolic, its blood is ejected into the aorta. So while this blood enters into the aorta, it was initial diameter of the initial diameter or wall of the aorta. So when this blood entered, the aorta expanded. The aorta expanded. Suppose 70 ml of blood is ejected into the aorta. Now this 70 ml will be accommodated within the aorta by their expansion. Okay, this is called Wind-Castle effect. I discussed it earlier. So because with this Wind-Castle effect, it will accommodate this extra 70 ml of blood into the aorta. So then it will, while it has entered into this, so it will be exerting pressure on the wall. Because of this pressure, it has expanded. Okay, so at this time, the pressure in the aorta is called systolic blood pressure. So pressure exerted in the aorta during the systole, it is called systolic blood pressure. And see, after the completion of the systole, now this valve will be closed. This aortic blood will be closed. No blood will be entering into this. Now, what will happen? Because of this elasticity, this vessel will come to its original position. As a result, that 70 ml of blood will be forced to the next level of or to the forward direction. So during this period, the pressure of the blood within the vessel is termed as diastolic pressure. So during diastole, the pressure exerted on the wall of the aorta or on the wall of the arteries are called diastolic blood pressure. And the pulse pressure is the difference between the systolic blood pressure and the diastolic pressure. Take what is the pressure in the aorta? Suppose it is 120 millimeter of mercury. Okay, and diastolic pressure is 80 millimeter of mercury. Then what would be the pulse pressure? Systolic minus diastolic, that is, what is the amount? 40 millimeter of mercury will be the pulse pressure. This pulse pressure, what does it signify? It signifies the force, the driving force of the blood. So what is the level of the force? If the force difference is 30, then driving force is less. If the difference is 50, the driving force is more. So it determines the driving force or another, the aorta expansion during systole, the same thing, systolic blood pressure, and during diastole it is closed. Now the pressure, because of Wind-Castle effect, the blood column will face one lateral pressure. This pressure is the diastolic pressure. And what is this? I can see the blood pressure, arteries, arterioles, capillaries, venous, right, and coming back to atrium. So how the pressure falls? Gradually it falls. Okay, as the arteries give branches. So with this branching, the pressure also gradually falls. So here in the capillaries, it will become mean pressure will be like this. What is this? About near 40 to 20 millimeter of mercury. And in the venous, it is even less. In the right atrium, it is near about 4 millimeter of mercury, 3 millimeter of mercury pressure. Okay. So this is the normal values of the blood pressure. This is the diastolic pressure and this is the systolic blood pressure. When the blood pressure, systolic blood pressure is 90 and diastolic blood pressure is 60. So this level is the hypotension or low blood pressure. So systolic pressure below 60 and diastolic pressure below 60. Okay. So this is, and what is the normal range? Systolic pressure 90 to 120 and diastolic pressure 60 to 80. If it goes beyond 20, this is low, this is ideal, and 120 to 140 systolic pressure, it is pre-hypertension. It is considered as pre-hypertension or pre-high blood pressure, and during this, what would be the diastolic pressure? 80 to 90. So if somebody's blood pressure is 80 to 90 diastolic and systolic is 120 to 40, it will be considered as pre-hypertension. Okay, and beyond 140 millimeter of mercury pressure, systolic pressure beyond 140 and diastolic beyond 90 is considered as hypertension. Okay. Now pulse pressure, it is the difference as I said, and it is the measure of the strength of the pressure wave. Okay, what is this pressure? What is the strength of the pressure? The blood is going forward. So what is the pressure? What is the disturbing force? It is determined by the pulse pressure. Okay. So then the mean pressure. Mean doesn't mean it is the systolic pressure plus diastolic pressure divided by 2. No, it is not that average. Here how you have to calculate the mean pressure? Mean pressure is diastolic pressure plus 1/3 of the pulse pressure. Now if 120 is the systolic and 80 is the diastolic pressure, what is the mean pressure? 40. Now divided by 3, how much it will come? This pressure you add with diastolic pressure, then you will get the mean pressure. So in case of 120 and 80 pressure, what would be the mean pressure? Calculate. So it will be around 93 millimeter of mercury. So what does this mean? It is the average pressure seen in the arteries. Average pressure seen in the arteries. Okay. Now the significance of the pressure. Why this pressure has to be exerted? Because first one is to maintain the flow, blood flow to the various organs, to supply the blood with adequate flow to various organs. That's why pressure is exerted. And another is ultimately what this blood has to reach to the tissue level, and there should be capillary exchange. There should be exchange of fluids between the cells and the capillaries. So for that purpose, in the capillaries, one pressure has to be created, that is hydrostatic pressure. If the hydrostatic pressure is more, then there will be more fluid will be passing from capillary into the tissue space. If it is less, then less fluid will be coming to the tissue space. Okay, so this capillary exchange depends on the hydrostatic pressure. This hydrostatic pressure is created by the blood pressure. Okay, and it is because of this urine is formed, because of this lymph is formed. Okay, so this is the significance of this and the function. See, the pressure of blood in the ventricle, because of this, stroke volume takes place. It happens during stroke. Some amount of blood can come out of the ventricle into the aorta. It is because of the pressure. And systemic arterial pressure, what do it do? it does blood flow to the tissues, means it maintains the perfusion in the tissue level. And capillary hydrostatic pressure, I said already, because of this capillary hydrostatic filtration in the tissue level is possible. Filtration in the kidneys is possible. And systemic venous pressure helps blood flow back to the heart. So veins are also having a pressure. Because of this pressure, the venous blood is coming back to, through venous return, coming back to the heart. So these are the functions of the blood. Let us now, what are the factors that affect the blood pressure? These, the main, we can divide this factor into central factors and peripheral factors. Central factors are two. One is cardiac output, another is heart rate. Okay, so if heart rate is increased, cardiac output will be more, so more blood will be entering, so more there will be pressure. Similarly, if the stroke volume is more amount of blood is entering into the aorta, so it will create more pressure. So, stroke volume, cardiac output will affect the arterial blood pressure. How we know? In our last class we discussed various factors affect cardiac output. So, since cardiac output is directly related to blood pressure, so the factors that are affecting cardiac output will also affect the blood pressure. Okay, so that I will not discuss here. And the heart rate, more blood is pumped, more will be the pressure. And the peripheral factors, there are some peripheral factors. What are these? One is peripheral resistance. If the peripheral blood vessels, arteries are constricted, so there will be resistance to flow, so pressure will be increased. So when there is peripheral resistance, the pressure will be increased. And venous return, increased venous return, more blood is coming to heart, and the heart will pump with more force, more stroke volume, more cardiac output, means more pressure. And the elasticity of the blood vessel, as we have seen in Windkessel effect, what is there? Some amount of blood is ejected into the blood, but because of elasticity, it has accommodated this pressure. If it is not possible to accommodate, then what will be? The lateral pressure will be much more. So that means if the arteries, vessels have less elasticity, then it will create more resistance, means more pressure will be generated. And if there is more elastic, if you apply pressure, it will be expanded. It is more elasticity, having higher elasticity. In that case, what will happen? Pressure rise will be less. But if it is rigid, in old age it happens. The blood vessels become rigid. Blood vessel loses the elasticity. As a result, it becomes rigid, pressure becomes high in old age. Okay, and velocity of blood flow, it is directly related to blood pressure. Higher the velocity, what will be there? Directly proportional to blood pressure will be increased, and diameter of the blood vessel, higher the diameter, less will be the pressure, less the diameter, more will be the pressure. And the viscosity of blood, viscosity is also very important. Viscosity means more viscous blood. So these will, when the blood becomes viscous, it will exert more resistance. So blood pressure will be increased. For example, what is the condition in which blood becomes what is this condition? Erythrocyte, more erythrocyte production. Okay, lot of erythrocytes, they are more than normal count. Be louder. So when blood cell production is, more blood cells are there in the blood, or more protein content is, plasma protein content is there, that means the blood will be, in such condition, blood will be more viscous. And viscosity is a resistance to blood flow, and means it will increase the blood pressure. And in case of anemia, the blood cells are very less, so low viscosity, what will happen? Pressure will be less. So those are the factors that affect blood pressure. Now we will discuss about the variation. What are the conditions in which, physiological condition in which pressure may vary? One is age. So as the age advances, As the age advances, pressure also increases. Sex in female, it is relatively less than the male, and circadian variation throughout the day. In 24 hours, blood pressure varies. At night, while we sleep, that blood pressure is less, but during activity, after getting up from the bed, then it starts to rise, and throughout the day, we sometimes we are very happy, we are excited, sometimes we are very anxious. So during this mental condition, blood pressure rises, again it comes to normal. So effect of gravity. So this is important. Effect of gravity. When we remember this, when we are in erect posture, here is the heart. Okay. So pressure above the heart level is less, and blood pressure below the heart level is more. Okay. And what is if the distance is 5 centimeter from here to here, the blood pressure will change by, for each centimeter it is 0.77 millimeter of mercury. Suppose at this level, systolic mean pressure is 120, and I am measuring the blood pressure at 10 centimeters below. So 10 centimeter into 0.77, so 7.7. Now you add 120 plus 7.7. What will be the result? 127.7 millimeter mercury will be the pressure here. So as you come down, the pressure will be rising. As you go up, above the at the same rate, blood pressure will fall. Okay, so this is the effect of gravity, and in an upright position, BP in the arteries below the heart level is increased, and that in the arteries above the heart level is decreased by 0.77 millimeter mercury for each centimeter of vertical distance from the level of the heart. Okay, the opposite is true when at the level of below the level of the heart. That's why when you will be measuring the heart blood pressure of a patient or your friend, it will be always at the heart level. You should measure we prefer the left hand, it is closer to the heart. Yes, that's why it is preferred. Which hand you will prefer, right hand or left hand? Usually which hand is preferred? Left hand, because this left hand is closer to your heart. Moreover, the arteries that is coming to here, it is originated from subclavian artery, and the angle of the subclavian, it is such that the blood flow is better in the left hand than the right hand. So that's why we choose the left hand. And in some patient, the blood pressure, right hand, left hand, there is a pressure difference. Sometimes there will not be any difference. So in that condition, any hand is preferable. But if you find a difference of more than 10 millimeter of mercury pressure, then there is some pathological problem. What is this? Suppose here is pressure is more, here it is less. That means some atherosclerotic problem may be there. Or there may be some, particularly these are seen in old age patients, elderly patients. So there is a possibility of stroke. So whenever we see the more than 10, so we should become very cautious that this patient may suffer stroke because of these differences. Sometimes it happens, you are sitting, suddenly you got up or attain the erect posture, and right at that moment you will feel drowsy, or the reeling of head will be there. Why? Means blood pressure. Suddenly there is fall of blood pressure in the brain. So brain is such that it cannot tolerate deficiency of blood for a few seconds or 3 seconds, not more than 3 seconds. So immediately it will give response. There is reeling of blood. But our body system is so adaptive, so it immediately immediately regulates this pressure so that the pressure is increased. We will discuss this, what are these regulatory mechanisms. So initially there will be fall, thereafter it will be again, the pressure will be regained. So, and the condition will be improved. And other conditions, posture, other than posture, there are other conditions also in which blood pressure will vary. What are these? Body build. Body build, more obese person, more will be the blood pressure, and after meal, usually blood pressure is increased. During sleep, blood pressure is low, and emotional condition, blood pressure is high, and during exercise, blood pressure is also increased. Now, during the exercise can be of two types, severe and moderate. In moderate exercise, SBP, systolic blood pressure may rise by 20 to 30 millimeter of mercury, and during severe exercise, it may rise for beyond 40 to 50 millimeter of mercury. These are more than normal. Okay. And now the regulation, very important part. I will try to cover it 30 minutes. So what are these regulatory conditions? There are 4 mechanisms. I have added another mechanism, that is the last one, fluid shift mechanism. So what are the initial 4 mechanisms? Nervous or neural mechanism, then there is renal mechanism, hormonal mechanism, and local mechanism. So this initial, the first one, nervous mechanism or neural mechanism, it is very fast. This, when there is change in blood pressure, our body, the nervous system will again maintain to its original position. Okay, so it will regulate in that fashion. And renal mechanism is the long term. So what is the condition? Suppose blood pressure is changing, either increasing or decreasing, but slowly, very slowly, day by day, month by month, year by year, gradually changing. This neural mechanism cannot control this pressure then. So will be maintained by the kidney. It will be maintained by the kidney. This is called renal control, renal mechanism. So renal mechanism is for long-term maintenance of blood pressure regulation, and nervous regulation is for immediate, very fast. Within few seconds, it can take control of the regulation. Okay, of blood pressure regulation. Let's see the neural mechanism. So these are the different nervous mechanism, renal mechanism, hormonal mechanism, local mechanism. And this mechanism, nervous mechanism, it involves vasomotor center and impulses from the periphery. Let us discuss about this. Okay, so this nervous mechanism will involve 3 things. What are these? One is medulla, the center, vasomotor center. So first it will involve a center, neural mechanism, so there must be a center. So it is the center. Beside this, what will be there? There will be some vasoconstrictor fibers and vasodilator fibers. Vasoconstrictor fibers, when blood pressure is low, it has to be increased. The vasoconstriction will be there, blood pressure will be increased. And vasodilator, when blood pressure is less, then what will blood pressure is less, then what will happen? So heart rate has to be increased, blood vessel has to be constricted, vasoconstrictor will come into action. When blood pressure is more, then vasodilator, they will dilate the vessel, blood pressure will come down. So the center will utilize 2 type of blood vessels, nerve fibers. One is vasoconstrictor fibers, another is vasodilator fibers. And vasoconstrictor fibers are nothing but sympathetic nerves, and vasodilator fibers are nothing but parasympathetic nerve. So actually it will involve sympathetic nervous system and the parasympathetic nervous system. And what will be the center? The medulla oblongata. So let us see. Nervous mechanism is short-term neural regulation. It operates through vasomotor system. Vasomotor system comprised of vasomotor center, vasoconstrictor fiber, that is sympathetic fiber nerves, and vasodilator fibers, parasympathetic nerve. These blood vessels, vasodilator, they will dilate the blood vessel, so blood pressure will be low, less resistance, more blood flow. Okay, in this way there will be vasoconstrictor fibers. Now the vasomotor center. Vasomotor center is having three components. One is pressure area or vasoconstrictor area, same name, same term, and it is located in RV, rostral ventrolateral medulla. Rostral ventrolateral medulla. And vasodilated area, if it is the medulla, so at the laterally they will be there, this side and the bilaterally, this side and that side. And the vasodilated area will be medial, towards the medial part of the medulla, means here and here. So let's see the one diagram. So it is the medulla. So here what is, we are having one pressure. This is the pressure area, or RV, rostral ventrolateral medulla, and this is the costal ventrolateral medulla. This is the deep pressure area, this is the pressure area. Okay, and it is the sensory area. We know the vasomotor center, it is having how many constituents? Three constituents. What are these? This is one constituent, sensory area, and this is the vasoconstrictor area. They will cause vasoconstriction and they cause vasodilatation. What is the mechanism? See, this RBLM, this is also RBLM. Here are the some neurons. When blood pressure has to be increased, heart rate has to be increased, what they do? They send impulse to the spinal cord. In the spinal cord, this is the gray matter. Within the gray matter, there are horn cells here. These are the lateral horn cells, intermediate lateral horn cells. So these lateral horn cells, from these actually sympathetic nerve fibers originate. Sympathetic nerve fiber originate from lateral horn cells of the spinal cord. Particularly, sympathetic nerve endings. So from here, sympathetic nerve will come out through the anterior root. Okay, they will form, this is the ganglia. So this is the preganglionic. Before the ganglia, this is the preganglionic fiber, and in the ganglia, they will form a synapse, and from here, another nerve will be formed, and this is postganglionic fiber. They will supply the heart, all parts of the heart, SA node, AV node, atrial muscle, ventricular muscle, every part of the heart. They also supply this sympathetic nerve, post-sympathetic nerve, they also supply the blood vessels. The blood vessels are having smooth muscles. So these smooth muscles are supplied by postganglionic nerve fiber. So when this area is stimulated, the impulse comes to here, they become stimulated, and this stimulation comes to heart, also to the blood vessel. Now what will happen? If it comes to heart, it stimulates the SA node, heartbeat will be increased. It stimulates the muscles, so there will be more force of contraction, and it will act on the AV node, so there will be more conductivity. It also increase the excitability. So all the functions of the heart is increased by the sympathetic nerve. So when we need to increase our blood pressure, what we will do? First we will increase our cardiac activity by this mechanism, by this sympathetic mechanism. So these are the sympathetic nerves, and these are the center in medulla. They are controlling the function of the lateral horn cells. Okay. Now they are also send these fibers also. I told when these fibers, sympathetic fiber, stimulate the arterioles. What happens to the arteriole? Constricted. Now, if the arterioles or blood vessels are constricted, what will happen? Resistance will be increased. As a result, blood pressure will be increased. More resistance, more will be the pressure. So, because of sympathetic activity, what will happen? Heart activity of the heart will increase and the vessels will be constricted, vasoconstriction, there will be increase in blood pressure. And so, because of activity of this, there will be increase in blood pressure. Because of contraction of this, there will be increase in blood pressure. Okay. Now see, another system, parasympathetic system also, this is vasoconstrictor fibers, vasoconstrictor nerves. So there is also vasodilator nerves. So what are these vasodilator nerves? Vasodilator nerves originate from NTS. And there is another nucleus ambiguous. Nucleus ambiguous. From here actually 10th vagus nerve originate, cranial nerve. 10th vagus means the 10th cranial nerve originate. They don't pass through the spinal cord. So as cranial nerve they come out and supply the heart. They don't supply the blood vessels. They supply the heart. So particularly which area of the heart? On the AC node and AV node and the atrial muscle, but they don't supply the ventricles. So that's why vagus nerve has no action on ventricle. It exerts its effect only on AC node, AV node and atrial muscle. What is this effect? It secretes acetylcholine. It is opposite to that of the sympathetic nerve. So, if sympathetic nerve ending produce adrenaline or noradrenaline, they will cause what? Increase in activity of the heart, constriction of the blood vessel. But if this is activated, what will happen? They will affect the heart and it will liberate acetylcholine, and acetylcholine has got the opposite effect. It reduces production of acidotal impulse, cardiac impulse, so heart rate will be decreased, okay, and its contractility will also be decreased, conductivity will also be decreased, okay. So sympathetic division will increase the cardiac activity and vasoconstriction, so blood pressure will be increased, and the parasympathetic nerves, they will reduce the activity of the heart. As a result cardiac output, stroke volume will be reduced and blood pressure will be reduced. Moreover, this nerve, this NTS will influence this pressure area. Pressure area means the lateral area, sympathetic centers, say they inhibit this. Okay, if these are inhibited, then they will not be able to send excitatory stimulus to the heart and to the blood vessel. So no constriction, vasoconstriction, no heart cardiac increased activity. As a result, blood pressure will be coming down. I will explain this. This is action reflex. What happens? If you make a scratch this way, okay, what happens? It is reddened. Immediately it is reddened. And why it is reddened? And what is the mechanism? It is because of action reflex. Okay, this reddening area is called flare. So there will be flare because of local vasodilatation. What happens? When you are scratching, there are some pain receptors. So they become stimulated. And this stimulation from this receptor will be going to the brain. Before going, it produces a branch and supply the blood vessel, local blood vessels. Now, and they are vasodilators. As a result, this local blood vessel become dilated, there is more blood flow, so that area, so because of that area becomes reddened. So this is the mechanism of this flare. Now see what happens. There is increased blood pressure, stimulation of the baroreceptors, impulses via 9th and 10th cranial nerve goes to the nucleus tractus solitarius NTS, and from here It causes stimulation of the vasoconstriction area and inhibition of vasoconstrictor area and stimulation of vasodilator area. So this will cause vasodilatation, means bradycardia, reduction in cardiac output, and since it is inhibited, so less discharge will be coming to the blood vessel to the heart. As a result, heart rate will be decreased and blood vessels will be dilated. So the normal blood pressure will be regained. Condition was key. Increased blood pressure. Now because of this mechanism, blood pressure will come down to normal. Two mechanism, baroreceptor, it is, the question comes. This question, sino-aortic, role of sino-aortic mechanism or simply by baroreceptor mechanism in control of blood pressure. Okay, so how you can explain? Firstly, you have to draw this diagram. What is this? The previous diagram, as I said, baroreceptors mechanism. So baroreceptors is located here and also here. What are these baroreceptors? They are located in the carotid sinus. In the carotid sinus, inflated area, carotid sinus, the wall of the carotid sinus, in the tunica adventitia, there are free nerve endings. So these free nerve endings become stimulated when the sinus is dilated, stressed. When it will be stressed? When blood pressure will be increased. So with the increase, and it is the safety valve for the brain. If high blood pressure, blood enters into with high blood pressure, there may be tearing of the blood vessels. So this is the safety valve. So it is warning, giving warning to the vasomotor center. Okay, blood pressure is very high, immediately you control it. So how it will be sending impulse through ninth cranial nerve. The cranial nerves are afferent as well as efferent. Not always these are efferent. They also carry sensory impulses. So here, from here, the ninth cranial nerve will carry impulses from these baroreceptors, and another type of baroreceptors are at the aorta. This is the aorta. Here are some baroreceptors. So they will also be stressed. Blood pressure is, systemic blood pressure is high. So as a result, wall will be stressed. Because of wall stressing of this, the baroreceptors will be stimulated, and they will also be stimulated. Here are the same. So two separate group of baroreceptors are there. So from here, it is important. You just take note how this impulse from these baroreceptors. What are the nerves? What are the afferent nerves? The afferent nerve is the aortic nerve. Afferent nerve is aortic nerve. Now this aortic nerve joins 10th cranial nerve. Now this 10th cranial nerve enters into the medulla and joins to the nucleus tractus solitarius. So this 10th aortic nerve, from aortic arch, this from baroreceptors, this is coming 10th cranial nerve, entering in the 10th into nucleus tractus solitarius. This is the sensory area of the vasomotor center. So similarly, the baroreceptors that are present in carotid sinus. So what is the nerve root? Aortic, from aortic arch, write it down. From aortic arch, initially by the aortic nerve. Now this aortic nerve will join the vagus nerve, and this will ultimately terminate into nucleus tractus solitarius of medulla oblongata. Okay, this is the root. Okay, now from here, there are also baroreceptors here. So they will be carried by another nerve, and this nerve is called sinus nerve, also called carotid sinus, also called Herring nerve, Herring, Herring's nerve. Okay, so the impulses from the baroreceptors is going through ninth cranial nerve. So first they will be carried by the Herring nerve or carotid sinus nerve, then they will join the ninth cranial nerve, and they will also enter into the nucleus tractus solitarius. So nucleus tractus solitarius gets input from the baroreceptors. what is happening in the baroreceptor. If the pressure is increased, the baroreceptors will be stimulated. Now the stimulation will come to the nucleus tractus solitarius. So now it will influence the vasomotor center, pressure area or deep pressure area. What to be done? Pressure is increased. Now what to be done? Pressure to be decreased. How can be decreased? How to decrease? We have to decrease the activity of the heart and dilate the blood vessel. So vasodilated area will be stimulated and vasoconstricted area will be inhibited. Okay, so NTS will cause stimulation of the vasodilated area and inhibition of the vasoconstricted area. As a result, what will be the consequence? Blood vessels will be dilated, so pressure will fall and cardiac activity will be reduced, blood pressure will fall. So in this way, it can respond. One question, write it down. What are buffer nerves? What are buffer nerves? What is their function? What is their function? So what are buffer nerves? These two nerves. One is aortic nerve and another is herring nerve. These two are called buffer nerve. They are important in regulating blood pressure. When blood pressure is increased, then what happens? Baroreceptors become stimulated and this impulse from the baroreceptor comes to the brain through these two nerves. And if these two nerves are cut, then information will not be coming to the nucleus tractus solitarius, so it cannot control, BMC cannot control the blood pressure. So these two nerves are actually taking part in controlling the blood pressure and heart rate. So that's why they are called herring nerve. Okay, are there any role of these two nerves when there is reduced blood pressure? Blood pressure is less. Now what to be done? Blood pressure has to be increased. Are there any role of these two nerves? Yes, there is. How this is being done? By chemoreceptors. By chemoreceptors. Now you can see here in this location there are some cells. These cells are called carotid body. These cells are, you can compare with an onion. In onion, what is there? Number of layers is there. Similarly here, number of cells are there. And in between the cells, this is highly vascularized. And these carotid bodies, they sense chemical changes in the blood. If there is any chemical change, immediately it brings to the notice of the vasomotor center. Okay, so similar kind of chemoreceptors are also present here. Here also there are some this kind of body. These are called aortic body. So aortic body and carotid body. These two bodies sense chemical changes in the blood. Now how this impulse will go to the brain? Same nerve, same aortic nerve, same carotid nerve. Okay, when this impulse comes to the brain, what will happen? Why these nerves are stimulated? Because of accumulation of some chemical changes in the blood. What chemical change? Write it down. One is increased carbon dioxide in the blood. What are these chemical change? Increased carbon dioxide in blood. When there is increased carbon dioxide in blood, there will be increased production of hydrogen ion. That means blood will become acidic. So this is second thing. Increased hydrogen ion concentration, increased carbon dioxide level and decreased oxygen. So in this condition, when this condition is seen, when there is reduced blood supply, means when there is decreased blood pressure, when there is decreased blood supply to the tissues, tissues will get less oxygen, produce more carbon dioxide, produce hydrogen ion. So these are indicators. This is all indicating that blood pressure is low. Now this impulse will coming to the brain. Now to the nucleus tractus solitarius. Now what it must do? It must increase the blood pressure. What it will do? NTS will now activate the deep pressure area, inhibit the deep pressure area. So now the pressure area will be increased. Now the pressure area increase means it will increase the activity of the heart, as well as there will be vasoconstriction. So there will be increase in blood pressure. Condition is improved. It was initially. So now a lot of, since blood pressure is increased, now a lot of blood supply will be there, lot of oxygen supply will be there, carbon dioxide will be washed out, the condition will be improved. Okay, so this is the synovial. That's why these two nerves are called buffer nerve. Buffering action. When there is increase, these two nerves will take action. When blood pressure is decreased, these two nerves will be involved in modifying, in changing heart rate and blood pressure. That's why they are called buffer nerve. So you can expect one question as buffer nerve. Okay, and sino-aortic mechanism or baroreceptor mechanism in control of blood pressure. Clear? So these are the carotid bodies. Here also you will get the carotid bodies. I already discussed chemoreceptor. The higher centers can modify the medullary vasomotor centers. Yeah? What are these? Cerebral cortex, area 13. Cerebral cortex, area 13. They can influence the blood pressure. And we sense emotion, we show emotional reactions because of the area 13. Area 13 not alone, together with limbic system and hypothalamus, they are all involved in our emotion, in our anger, in our anxiety, in our excitement. So all emotional reactions are controlled by these three brain organs, okay, brain tissues. So when they are stimulated, this stimulation, emotional reaction take place, they will affect the vasomotor center. In this sort of emotional reaction, what happens? Blood pressure increases or decreases, heart rate increases or decreases. During your emotional reactions, heart rate increases. That means blood pressure will be increased. Okay, so pressure will be increased. So they will activate the vasomotor center, particularly the pressure area or vasoconstrictor area. Okay, so as a result, these higher centers, modify, also has the role in changing the blood pressure through modifying the activity of the medullary vasomotor centers. Renal regulatory mechanism, long-term procedure. When it acts, when blood flow to the glomeruli, what is there in nephron? Afferent arteriole, efferent arteriole, JG apparatus. When blood flow is decreased in the nephron, nephron, the JG apparatus secretes one hormone. This is called renin. What is this? Renin. R-E-N-I-N, renin. So it is released into the blood. Now in the blood, it will find a protein in the plasma. What is this protein? It is a alpha globulin. And what is this alpha globulin? It is called angiotensinogen. What is this protein? Angiotensinogen. Now, this renin will convert this angiotensinogen into angiotensin 1. So, angiotensin is converted by the renin. When renin is produced, when afferent arteriole is having less blood supply, less glomerular filtration is producing, less urination is there, less formation of urine. So this is the condition. Okay. So what will happen now? Angiotensin 1 in the blood will come to the lung. In the lung bed, lung capillaries, there is one enzyme, ECE. What is this enzyme? Angiotensin, ACE, not ECE, angiotensin converting enzyme. Angiotensin ACE, angiotensin converting enzyme, they will convert angiotensin 1 into angiotensin 2. Now, angiotensin 2 is a strong vasoconstrictor. So, what will happen? It will increase, it will cause vasoconstriction throughout the body. As a result, what will be? Blood pressure will be increased. Vasoconstriction, massive blood pressure will be increased. Now, because of this increased blood pressure, the glomerular afferent in afferent arteriole also it will be increased. In afferent arteriole, blood pressure will also be increased. Now, since blood pressure in the afferent arteriole is increased, no need of secreting renin. So, now no renin production, no more production of angiotensin 1 and 2. So, no further vasoconstriction. Blood pressure is resumed to normal level. Besides, it also acts, the angiotensin also acts on adrenal cortex. On adrenal cortex. Here it stimulates aldosterone secretion. Aldosterone secretion. So what is the function of the aldosterone? Aldosterone has got two functions. One is absorption of sodium from the renal tubule. So in the nephron, in the glomerulus, filtrate is produced. Lot of sodium ion, lot of water is there. So by the action of the aldosterone, what will be there? This sodium ion will be absorbed, and sodium ion will not be coming alone. Together with water it will come. So sodium ion along with water will be absorbed into the blood. So in the vessel, in the body, in the blood, in blood vessel, amount of blood will be increased. If amount of blood is increased, blood volume is increased, blood pressure is increased. So condition was what? Low blood pressure. So now there is more blood pressure. Moreover, this angiotensin 2 also stimulates hypothalamus. And hypothalamus stimulates antidiuretic hormone. At the same time, it also stimulates thirst. It will cause thirst. So we will take fluid. So more fluid, more absorption of fluid, and more volume of blood, condition is improved. And because of ADS, antidiuretic hormone, it will absorb more water from the urine, from the renal filtrate. So from this more water will be coming in this way. This renal angiotensin kidney, renin-angiotensin vasopressin system in a long term can control your blood pressure. Okay, you understood this? See this mechanism? Decreased blood pressure, JG cells stimulate secretes renin, angiotensin is converted into angiotensin 1, and this is converted by into angiotensin 2 by ACE. Now it will cause vasoconstriction, so there will be increasing blood pressure. It will also call adrenal cortex to secrete aldosterone. Aldosterone will act on kidney. It will cause the absorption of water and sodium. So there will be increased extracellular fluid volume as well as blood volume. So since blood volume is increased, there will be increased blood pressure. So this is the beautiful mechanism by which kidney. That's why when there is a renal failure, kidney failure, some hypertension is produced. This is called renal hypertension. Why? This mechanism cannot act. Controlling mechanism is not there. Hormonal mechanism. So, very less time. So, there are some hormones, they cause vasoconstriction. Number one, adrenaline secreted from the adrenal medulla. Adrenaline, noradrenaline, they increase blood pressure, they increase heart rate. So, blood pressure can be increased by this. Thyroxine also increases blood pressure. 8 times thyroxine. What happens? Thyroxine increases systolic blood pressure but lowers diastolic blood pressure. How? Systolic blood pressure, it increases the heart cardiac activity. By that mechanism, it increases systolic blood pressure. And diastolic blood pressure, why diastolic pressure is decreased? Diastolic pressure is decreased because there is in thyroxine causes increased metabolism in our body. Because of increased metabolism, what happens? There will be lot of metabolites will be produced, like adenosine, like carbon dioxide, low pH. They all stimulate blood vessels. Vasodilates, cause vasodilatation of the blood vessels. So if blood vessels are dilated by these metabolites, then what will happen? Resistance will be less, so diastolic pressure will be less. More resistance, more diastolic pressure. Less resistance, less diastolic pressure. Always remember this thing. Somebody is having high diastolic pressure, means he is having high peripheral resistance. Either viscosity is more or blood vessels are constricted, so that is the cause. Not because of increased heartbeat, increased cardiac output. Peripheral, because of peripheral. And if somebody is having high systolic BP, means cardiac activity is more. So, purpose is to if I want to reduce the systolic BP, you have to reduce the cardiac activity. Okay, if diastolic blood pressure, you have to apply vasodilator drugs. That will dilate the blood vessels, so blood pressure will be reduced. And aldosterone, absorption of sodium, absorption of water, they will increase the blood volume, so blood pressure will be increased. Vasopressin, blood pressure will be increased. And this another name of vasopressin is ADH. ADH increases water absorption. As a result, more blood volume, more pressure. Angiotensin 2 we have already vasoconstrictor, so they will cause increase in blood pressure. Serotonin also a vasoconstrictor drug, it will also increase the blood pressure. These are all vasoconstrictor drugs. Okay, hormones which decrease the blood pressure means they will cause vasodilation. What are these? These are VIP, vasoactive intestinal peptide. Vasoactive intestinal peptide. So we have learned while in digestion lot of intestinal hormones, GI hormones. So VIP is one of the GI hormones. They are vasodilator. So they can decrease the blood pressure level. And ANP, atrial natriuretic factor. Atrial means atrial inner wall, inner lining, endothelium. They can produce this ANP, atrial natriuretic. These are vasodilators. BNP, these are brain natriuretic factor. Brain, from the brain tissue, also these factors are liberated. They cause vasodilatation in the brain. So adequate blood supply in the brain can be maintained. And C-type NP, it is another type of natriuretic. Natriuretic means it increases sodium absorption. Okay, it increases sodium absorption and along with blood, so locally there will be more blood, so blood vessel will be dilated. Bradykinin, vasodilator, prostaglandin, vasodilator, acetylcholine are also vasodilator. So these are the hormones that constricts, and some hormones can dilate. So by constricting, dilating, blood pressure is maintained. And lastly, local mechanism. This local mechanism means locally in the local area, they will produce two kind of things from the blood vessels itself. So some of these chemicals will act as vasoconstrictors, some will act as vasodilator. See, prostacyclin and thromboxane, these are secreted, made from endothelin. From the inner lining of the endothelium, this endothelin is produced. Now this endothelin, by several reactions, which produces prostacyclin A and prostacyclin and thromboxane A2, and these are two vasoconstrictors locally. So by this vasoconstrictor, blood pressure can be increased. Okay, then vasodilators. are two types. One is metabolite, another is produced by the endothelium. Okay, metabolites in the tissue. So what are the metabolites in the tissue? Nitric oxides. Metabolites in the tissue: carbon dioxide, lactic acid, hydrogen ion, and adenosine. Okay, so their increased level will cause vasodilation, and they also cause vasodilation, nitric oxide. These are used in the counter. These nitric oxide tablets are available. So these are used for various purposes. I will not tell you the purpose. So these are for only to dilate the blood vessels, means to increase the blood supply to the organ, to the tissues. So that is the purpose as vasodilator. Thank you.